Hi everyone, hope you're all doing well. Just wanted to go over our information from last week and talk a little bit about the week to come here in week 2. So hopefully your summer term is going well so far. Just getting started, obviously. Congrats to all of you that walked in commencement last week. I saw a few pictures that Dr. Hampy had sent over, and it was great to see you, and the exciting that you're almost at the end of your program. So last week was really kind of the base of our class here in ethics. And throughout the class, we're going to talk about different areas of ethics. We'll talk a little bit about bioethics, a little bit about business ethics, a little bit about the role of the administrator in relation to ethics. But I really would suggest, challenge yourself to think about, as a healthcare administrator, how you would react in some of these situations. I think that it's interesting. We're having a bit of an issue. You may be familiar throughout your time here with the organization AUPHA, which is the Association of University Programs in Health Administration. They're the folks that kind of are the overarching professional organization for programs like ours, health administration programs, undergraduate, graduate, etc. And we're dealing with an ethical dilemma. We have an open forum where we share information about our programs and teaching tips and things like that. And the person that is the incoming board chair, who will take their office in June, posted a lengthy diatribe about mask use, the hoax of COVID, the fact that vaccines are dangerous, and kind of all of the anti-masker, anti-vaxxer, COVID conspiracy stuff that we see from lots of folks. And I personally am not, that's not my line of belief, but everyone's entitled to their own opinion. And so the reason I share this, you might be thinking, why is she saying this? The reason I share this is that as a health administrator, much like her as the board chair, and we're all entitled to our own opinion. So what one person thinks is ethical, another person may not. However, in our role as a health administrator, just like her in her role as the incoming board chair, you need to not have a biased view of things overall. So you need to look at a situation from both aspects. Typically, there's one side and the other. Sometimes there's more than two sides to something, but you need to look at it from an unbiased perspective and understand that where you may believe something, others may not. So where you may believe that masks don't work and vaccines are dangerous, other people do believe that masks do work and vaccines aren't dangerous and are helpful. So what's important is that you need to take an unbiased look at things, and especially because we work in healthcare. There's a lot of clinical evidence that supports lots of different things. There's clinical evidence that supports mask use and lots of things related to the pandemic. But so kind of discrediting some of the thoughts that the incoming board chair has. But in the same vein, we also see that in some of the dilemmas we see in our healthcare organizations, and we need to balance our own personal ethic with clinical evidence that exists. Evidence-based research, evidence-based decision making is our role, and make sure that we're making the best decision for our organization and not necessarily based on our own personal ethics, which could be different than the overall ethic of the organization. So I digress a little bit, but I think it's important to know and to work through this class understanding that perhaps you may have a different ethical view on something from someone else in the class. And it was, just like that, they have like a message board where you post things, and she posted this long diatribe, and it was shocking to most of us because we all work in a science field where science has proven many of these things. But that's her right to have that belief. But she can't have that belief on behalf of the AUPHA. She can have that belief in her own personal life, but as the board chair of AUPHA, she needs to be able to see both sides of the coin, much like you guys will have to in your work as health administrators, but then also, as we're looking at our discussions, make sure that you're looking at both sides of the coin, of whatever it is. I always say, the best way to make a decision on a tough ethical issue is to consider your own opinion, but then be the devil's advocate. If you're not looking at the other side, you're not fully examining the issue. So, long story short, that's what we want to be doing in this class. So, obviously, last week it kind of started out learning about a few of the different pieces of ethics. If you were in our undergrad program, you've probably heard many of these already, because we do teach that in our ethics class there as well. But so things like beneficence and non-malfeasance and respect for persons, justice, etc. Learning about some of the basic theory behind ethics. And then as we move through, we'll continue our discussion and build upon with case study review, because that's really typically the best way to study ethics overall. So we did have a quiz last week, so I do want to hop in and take a look at that. The one question that we had in the quiz, this one. So where should a health services manager start when trying to identify ethical issues? I think that perhaps I wrote this question from the prior version of the book, because I don't remember anything about the Fab Four, or maybe it was, we used to have recorded lectures in this class, but I found that people didn't watch them. So it could have been in that where I talked about the Fab Four. But the Fab Four are those main, and let me see, oh, there's my book. They're listed in the book, but they're not called the Fab Four anymore, so I'm sure that's probably why folks were confused about what that is. But so if you do have the print copy of the book, the 6th edition of the book, starting on page 27, it talks about kind of the 4 big overarching principles that provide us some context with relation to ethics in healthcare. So respect for persons, beneficence, non-malfeasance, and justice. So that's the Fab Four. And so what I was talking about in here, and I do remember it in some discussion in the past, so I'm thinking maybe it came from one of those lectures that I've removed. But so where should a health service manager start when trying to identify issues? Obviously, we don't want to wait until it hits the news. In some organizations, we may request the help of somebody, but we would need to know what an issue was. So at this point, we're trying to identify an issue. An ethics committee meeting probably wouldn't be convened until, again, we knew that there was an issue. But so what we want to do is assess the health service organization's actions in light of those 4 main contextual principles. So that's where that came from. So our correct answer was B. Nobody got it right, because I'm sure nobody knew what the Fab Four was. And I'll go through and give everyone credit for that. I haven't done it yet, but just be aware of that when you're thinking about, okay, where as a manager, where will I start to identify ethical issues in my organization? And this is something that you should probably do on a fairly regular basis. Think about the actions of the organization in conjunction with those 4 main principles, and see where it pans out. Where are there issues? Where are there things where maybe we can provide education to people? And probably the biggest ethical issue outside of business ethics related problems, fraud and abuse and inappropriate dealings and that kind of stuff, the biggest ethical issue I see in healthcare organizations are exactly what I had talked about with the AUPHA person, in that a person's personal ethical principle is being pushed upon patients within the organization. So a patient comes to the organization to maybe look to have a sterilization procedure, or maybe they are seeking family planning advice or an abortion. And if those are services that your organization offers, having staff members try and talk them out of those things because it's against their own personal ethical beliefs. And so, like I said, we're all entitled to have our own beliefs. There's nothing wrong with that, and it's actually encouraged. If everyone was the same, life would be pretty boring. So we're all entitled to have our own beliefs about anything. The problem is when you're acting on behalf of an organization, you need to be acting in their best interest. And if that is not the belief of the organization, then it's inappropriate for a staff member to be pushing that on patients. So next question, Golden Rule summarizes which of the moral philosophies that are listed here. So deontology is the option that was correct. These are all different theories and philosophies that were noted in the text. But deontology is really, do unto others as you would have them do unto you. So if you can't be nice, don't be anything, those types of things. So it's all about that golden rule that most of us learned in kindergarten. Be nice to other people because you want them to be nice to you. And so that is really the basics of deontology. Next question. Blank is treatment that is provided without excessive expense, pain, or inconvenience, offers reasonable hope of benefit, while blank is treatment that carries excessive expense, pain, and inconvenience, and does not offer reasonable hope of benefit. So ordinary care is that treatment where we've taken that risk benefit analysis and the benefit is there for that treatment. Whereas extraordinary care is that treatment that is excessive and doesn't really offer a reasonable hope of benefit. And there are certainly organizations that will look at situations like that and suggest that extraordinary care measures are not taken because of the fact that there's very little risk of or very little potential of benefit, and the risks are high and painful for the patient and those types of things. So ordinary care versus extraordinary care, those are the two options there. I think, yep, this is the last one. It is not acceptable for an organization to seek legal intervention and permission to treat an infant against the parent's wishes. So this is actually false. It is acceptable for an organization to seek legal intervention. And there's a story in the textbook about, I think they're baby doe or whatever, but there's a story about a child who had an issue within their GI system, but also was would be developmentally delayed because of whatever genetics or whatever it happened to be in that case. And so the parents, I'm pretty sure if I remember correctly, it's been a while since I read the chapter, but I'm pretty sure the parents let the child die. The reason that they died was just this disconnect in their GI system that could have been easily corrected, but they chose to let the baby die because the baby was going to be mentally retarded. So they didn't go that route. And today, if that were to occur, it's likely that the organization would intervene and say, there's no reason to let this child starve to death. Let's do this surgery. And then it would be, because that's considered child abuse. You can't starve your child at home. In this case, that's what they were looking to do as well. So the Child Abuse Prevention and Treatment Act was put in place, I think in the 80s, to allow organizations to intervene in these types of situations so that this type of situation wouldn't occur again in the future. So those are our questions. Let's hop back over to the classroom quick. I've only got a couple minutes left here on my video recording options. So this week we're going to start looking at some of the tools that we use to guide decision making, codes of conduct, mission, vision, values, those types of things. So lots of different info in the classroom about that. Obviously we have our textbook reading as well. We do have a discussion about codes of ethics, codes of conduct, etc. I encourage you to share one from your own. You can certainly talk about ACHE if you don't have one of your own, but if you are in nursing or if you've worked in the physician practice or if you work in nuke med, long-term care, etc., please feel free to share one of those organizations' code of conduct, and that would be helpful for the discussion. And we do have a case study that's done in groups, so our groups are listed here. So keep that in mind. You're going to want to be working throughout the week. We do have a quiz and obviously this Ed puzzle, which will pop up here in just a few minutes, actually. So that's all I've got for everyone. If you have any issues, questions, please feel free to reach out. Again, congrats to those that walked in commencement. We'll, push hard through the summer, and you'll have the paper to go with the regalia here soon enough. So again, any questions, let me know. I think everyone here knows, but I am in Florida, so I'm not able to meet with you personally there in the Pittsburgh area, but happy to meet up on Google Meet or chat on the telephone or discuss things via email, whatever works best for you guys if you have any questions or issues. So have a great week, and we'll see you in the classroom. Thanks.